Hi everybody, my name's Jane and I'd like to begin by paying my respects to the Wurundjeri people, to the traditional custodies of this land where we are meeting upon today, for its elders and past and presents, and even for the self-advocacy people who have passed away and who are still here on Aboriginal land today. Thank you.
Welcome to 3CR, Raising Our Voices, 8:55 a.m. Today we are talking about public transport and COVID-19 for people with disabilities. We've got Kerri Cassidy from Disability Resource Centre with us, along with Jane Rosengrave, Luke Stone and Lisa Bromptus. We are discussing what it's like during this pandemic to be travelling on public transport. We've involved Disability Resource Centre Executive Director Kerri Cassidy because the Disability Resource Centre issued a report about public transport and accessibility. And we'd like to know your thoughts, Kerri. And I think Luke has a question to begin with.
My question is, what is the distance for people traveling on public transport?
Thank you for your question, Luke. What distance do we need to keep when we're travelling on public transport? I think we know, we've heard a lot over the last few months about keeping at least a 1.5 metre distance. But when you're on public transport, that's not always easy because people are getting on and getting off. And you'll find perhaps on the train that there'll be seats that are marked so you can't sit on them to make sure that you keep distance. But I think you really need to do your best to look around everybody say we're on the train, and if someone gets a little bit too close, we can ask them perhaps to move over. But really, it's very hard when it's busy because everyone does squish in, don't they? So one thing you can do is try and travel in times when the train isn't busy. So maybe really early in the morning or during the day, and then after peak hour at night. So all of the trains, buses and trams are running normally, same times while they're meant to be. So you can select the time that you travel as best you can for a time when it's not going to be so crowded.
So how many people per carriage? How many people?
I think it depends on the train. It depends on the type of transport as to how many people they can have. But ideally, I actually don't know the answer to that. Does anyone else know? How many? Do you know, Luke?
No.
I don't know either, but one of the questions that I did have was, where can we find out more information about travelling on public transport during this time for people with disabilities?
Sure. Well, PTV, Public Transport Victoria, they do have a website that you can go to, and they have some information about what's happening during the pandemic period, like how they're doing more cleaning. They talk about what I said before about travelling at times when it's not too busy, perhaps wearing masks, making sure you wash your hands, all of those things. But they also have a phone number if you have questions that aren't covered on the web page, or perhaps maybe you don't even have a computer to check the web page. And do you want the phone number? Can I give that to you? And maybe our listeners might find it useful.
Yeah,
absolutely.
The Public Transport Call Centre, they can take any of these questions. Their number is 1-800-800-007. I'll say it again. 1-800-800-007. And they can answer any of your questions there.
I've been on the trams, I have, and the trains, but I know sometimes it's there is a lot of people, and you sometimes can't help it if you're close to someone on this at this time. You know, sometimes there is a lot of people that do go on the trams and the trains, coming home from work or going to work.
That's right. And do you notice are people wearing masks at the moment?
Yeah. I've noticed a lot of people wearing masks. And even I see a lot of the cleaners, which is good, cleaning up the tram stops, you know, the windows, what we touch, and even on the trams as well, cleaning on the trams and the trains, you know, yeah.
And I think you'll find, particularly in the city stations and stops, there's more and more hand sanitizer stations. Have you noticed that?
Yes, I have, and even in supermarkets as well, and office works and train stations and all that, yes.
That's right. So when you see them, it's a good idea to take the time to wash your hands.
I do.
That's excellent.
That's right, definitely, because I don't want the disease. I don't want to die yet.
Are there any forms of transport that are safer than others? Is it safer to take a bus than a train, or a tram than a bus?
I don't believe so, because they're all public transport. So they all attract the same type of people and the same amount.
Yeah.
Although I can't imagine peak hour being as peak as it was.
I don't think so. I think with the messages we've been receiving from the Premier for Victoria, asking people to stay at home if they can, especially if they're unwell, that there are less people out and about.
And I was just thinking, you know, because of the AFL at the moment, that no footy's been played here in Victoria, that with those players that go on the jet, they are close to each other when they have to fly to another state.
Yeah, I think plane transport is not very safe.
No.
If I was catching a plane, I would definitely be using a mask and lots of hand sanitizer and trying to keep my distance.
We don't have to worry about that, because Victoria's been banned from pretty much the entire country.
We can't go anywhere. That's right.
Right.
I think the key thing to think about when you're trying to decide on how to travel is what are the types of transport that's likely to be less busy. So maybe if you've got some options, we talked about travelling at different times, but maybe you can actually walk a bit further than you normally do. That's
I basically haven't taken any public transport during this time, except a tram.
Yes, and I think that's the same for many people, because we're not going out unless we really have to. So I went on a train about 3 weeks ago, and I went in the middle of the day to make sure it wasn't too busy. And then when I got on the train, I sat somewhere where there weren't a whole lot of other people. And I was really happy to see that other people were doing the same thing. They were all spreading out in the train, making sure that we had as much distance as possible. And that's really all we can do, apart from perhaps wearing a mask and making sure our hands are clean before we get on and when we get off. But being aware of other people around you.
I've heard the other thing. I've heard that masks will be compulsory on public transport from today, or from now.
I haven't heard that it's compulsory, but I believe we're hearing more and more that it's a good thing to do, that it helps protect you. It doesn't completely stop you from breathing in the virus, but it stops a lot of it. So if you can, I think it's a very good idea to have a face mask before you get on public transport, or even if you're in public areas that are really busy.
And even if you're in the mall, when you're walking in the mall, there's a lot of people. And I know sometimes, you know, you can sometimes get close to people when you're walking in the mall.
Yeah.
Yeah.
I've noticed that too, especially in shopping centre or a supermarket, where it's almost impossible to social distance at sometimes.
Yeah.
So I think I choose to use a mask when I know that I'm not going to be able to social distance. Most likely, I've been using one. I know in some countries it's been compulsory. It's been part of the law, and people get fined if they don't wear one. But I don't think that's here.
Not yet, anyway.
No.
What about wearing gloves? Do we think that's helpful?
Maybe.
It would be, yeah.
Yeah, I think it can be. But what you have to remember is if you're wearing gloves that you still can't touch your face if you've touched other surfaces with your gloves.
That's
And
right.
if you touch your telephone and then put your telephone on your face, you can spread germs in that way. So whilst we can wear gloves, when we're touching buttons, say, on public transport, we have to be really careful that we're not touching things then with the gloves.
Yes.
And so I think that's why washing your hands is really, really important.
That's right.
Gloves can be helpful in some circumstances, but they don't protect you from spreading germs.
That's right. And it's another thing I thought of, money, dollars. That's another one. And coins.
But they're not using them anymore.
Well, they are still, but there is some shops that are having it on card, but when you go to the bank, there's other people who've touched that money.
That's right.
You know
And
what I mean?
know PTV have asked people to be really careful about using money and suggesting that you find cashless ways of putting money on your MyKey so that you're not having to share money, give money backwards and forwards, exactly like you were saying, Jane. And that's one way, because you're exactly right. And lots of places are saying no cash for that reason.
That's right.
Yeah.
Yeah.
We'd like to go for a music break now, so we'll be listening to Saint-Germain, Rose Rouge.
I chose this song because it kind of sounds like being on a train. The background noise, the beat in the background, or being on a tram or a bus or going somewhere. It reminds me of travelling somewhere. I want you to get together. I want you to get together. Put your hands together one time. I want you to get together. 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 Put your hands together one time. I want you to get together.
I want you to get together. I want you to get together. I want you to get together. Put your hands together one time. I want you to get together. I want you to get together. Put your hands together one time. I want you to get together. I want you to get together.
You're on 3CR and you've just been listening to a song called Rose Rouge by Saint Germain.
You're listening to Raising Our Voices on 3CR. We're talking with Kerri Cassidy from the Disability Resource Centre, with Jane, Luke and Lisa today. We're discussing public transport and the COVID-19 virus for people with disability. Now, I'm wondering, what improvements has anybody noticed that could be made to public transport to make it safer for people with disabilities or chronic health conditions, especially respiratory like asthma or breathing problems, any kind of lung conditions? I'm really wondering what could be improved. Does anyone have thoughts on this?
Well, I think they've already made a couple of improvements in the cleaning, because I've seen people everywhere clean stops and I'm sure on trams and that. So they've been really good in that way.
For me, I guess the first thing is I only travel if I have to, but these are decisions I can make. But what perhaps can we ask PTV to improve to make it safer? We know that there are some hand sanitising stations. Maybe we can ask for them to be there to be more around places. The other thing I thought of is I couldn't actually find out where those sanitised stations are. So maybe there's a way that we can find out so we know when we're travelling where to go to find hand sanitizer. Yeah.
Public toilets. There's no soap in these public toilets, I know. What about if there should be hand sanitizers at these public toilets?
That's an excellent point. Because we all have to use public toilets at different times.
Yeah.
And I know they're cleaning them more often, but it only needs the person in front of you to not clean their space before they leave. So yeah, making sure that proper soap is in every public toilet.
Well, you should look
really
into
good.
that, because there's none, because I go down to the homeless and for meals, and I know down at the Victoria Market, the public toilets down there, there's no hand sanitisers there, and there's no hand sanitisers in any of the other public toilets in the city.
Yes.
The one that I stop in, I don't even know if the soap dispenser works.
Oh, gee.
Well, maybe it's something that we should be asking PTV, because in particular, to check their stations and
Yes.
public areas to make sure they have everything in working order in their toilet.
Yes, definitely.
One other thing I thought of, which I think would be good, is if PTV had masks available for us at the station.
Yes.
So that when you
That would be a
get
good
there,
idea.
that everybody, when you tap on your my key or you walk through the gate, that there are masks there and you can just take one
Yeah.
to wear during your journey. That's one
Yeah.
thing I thought of.
It's a really good idea, but that would be like detrimental to the economy too,
Do you think so? Why is that?
because it would cost.
Yeah, and that's the thing. And I think that's why not everybody is wearing masks when perhaps they want to, because they can be very expensive, especially if you only wear them once and then dispose of them. So I think that's a really good point. And particularly for people who are on low incomes, it's just not another expense that people need right now.
No.
And that's why I think if we're using public transport and we're paying for our tickets, so it'd be great to think that some of the ticket money goes towards keeping us all safe And perhaps one way is by providing masks. That's one idea.
Yeah.
Yeah. I think it should be compulsory to wear masks on trains and buses. Avoid distance.
You think it should be compulsory to wear masks on public transport? Yeah, I think I think that would be great, but I think when you're going to make a rule like that, you need to provide easy access for people to get them. Yeah, I agree. So, Luke, are you catching public transport often at the moment, or are you mostly staying home? Yeah.
It's transport that be on special timetable or normal timetable.
Is it a special timetable or normal timetable?
Yes.
Yeah. I believe all of the public transport is running to normal timetables because there's people who simply have to use public transport because they are working and they don't have a choice to jump in a car. Perhaps they can't drive or they don't have a car. So the PTV have made sure that trains, trams and buses are all still running so people can get to where they need to be.
Do you think the transport should be on special transport timetable because not many people travel at the moment?
Do I think the timetable should be changed because not many people are travelling? I think we need to still have lots of services running so that there's not too many people on any one train, tram or bus. I think if we had less services, it would mean more people have to squeeze in, particularly around those busy times. It also means that, people, the bus drivers and the train drivers, their jobs are still going, and that's a good thing.
I heard some of the big staff COVID-19.
You heard some staff got COVID-19. That's right. I heard that too on the news.
Public transport staff.
Yeah, that's right. And I think it was a reminder to me that wherever you go, you have to be aware that there could be people who are not well, who are sick. So no matter where you go, whether you're on the train or off the train, keeping that distance between you and other people is really important.
Yeah. But it's sometimes hard when there's more, when there's a bit of a crowd on the tram or the bus or the train, you know what I mean?
That's right.
Yeah.
Very hard. But I think it's up to us individually to all do the right thing. And the more of us who do, the safer everybody is.
Yeah.
When you're in a situation where you don't feel safe, then at that time, it's important to try and find a way to remove yourself from that space so you feel safe again. And so
But that would be general. It's not just now for the COVID-19 thing.
Yeah, I think we will be like this for a long time into the future.
I hope so.
And whether you're on public transport or you're in Burke Street Mall or in a shopping centre, the same rules apply.
Yeah, so it could happen, it could go on all next year.
That's right. But I think we will have learnt ways of living and moving about to make sure that we're as safe as possible. And I think we'll continue to do those things. Keep our hands washed and not get too close to people who are sick, not go out if we're sick. That's a really important thing. Yeah.
Kerri, I'd like to ask you if you'd be able to share that number again for Public Transport Victoria about where people can get more information to be informed about how to stay safe.
Sure. That number is 1-800-800-007. 1-800-800-007. And if you're interested in making public transport more accessible for people with disabilities, you can join our campaign. And the way to do that is through our website at drc.org.au.
Thank you very much. And please do follow the rules, use hand sanitizer, social distance, and keep safe where you can. Thanks to Kerri from Disability Resource Centre, to Jane, Luke and Lisa for joining us. We've been recording using social distancing. Please tune in for our next Raising Our Voices show next month on 8:55 a.m. Stay tuned.
You've been listening to a 3CR podcast produced in the studios of independent community radio station 3CR in Melbourne, Australia. For more information, go to allthews.3cr.org.au.